What I like most about living in Alice Springs is the countryside, the beauty of the country, the people around here, the Indigenous clients are wonderful to work with. It is a challenge trying to get our clients in because we cover an area roughly over 1 million square kilometres. Some people can travel up to 12 hours to get here in order to access a service. Where they're living is very remote and they might have a clinic nurse and a visiting DMO, and that's it. In some cases they aren't able to make it for various reasons, and some of it can be cultural, some of it can be just mechanical. If you miss a bus, that's it for probably a week.
So the Physiotherapy Orthopaedic Clinic from Women's and Children sees patients that have come from all over Northern Territory. The program services any children that are referred, so we see children that are referred by local physiotherapists in Alice Springs that want a second opinion about a patient. We see children that are referred from more remote communities that are seen in local health services and are referred in for an assessment. We see children that are seen by the orthopaedic specialist that comes up to the clinics as well. He may consult on a patient and say that they need some physiotherapy interventions, so refer them through to us to be seen at the same visit. And we see children for ongoing needs, so we'll see children in the clinic that we follow up right through growth. We may see them for 10 to 18 years or so for ongoing input.
As an adjunct to our services here, because we're basically generalist physios or paediatricians, and they come up with a specialised service to actually give us assistance to get the best outcomes for the clientele that we have.
So we come up from Adelaide 4 times a year, so it's a senior physiotherapist from the Children's Hospital and also an orthopaedic surgeon, Dr Bruce Foster. When we come up for the clinics, we come for 3 days. The clinic may have 40 or 50 patients booked into it, and we may have all of them come, we may have 10 of them come. So there's lots of factors that play into that, but it can be really variable and can be incredibly busy when we do get full clinics.
We actually get a lot of in-servicing and training from the specialised physios that come up to keep us up to date with the latest treatments for our clients, therefore getting a better outcome.
During the stay, I'll usually do some education with the local physiotherapy staff. We'll usually try to have one of the junior physios in with us in the clinic for the whole time we're here, and we do a lot of ongoing teaching during those times. It's certainly different cases up here that we see, very similar pathology I guess in background, but the amount of intervention that the children have had previously is generally quite different to what we see in Adelaide. Certainly when I first started coming up for the clinics it was quite eye-opening, some of the kids that would walk into the clinic. The children that are remote and don't access health services as ideally as they could, some of those conditions are quite different that we see.
After working here for 14 years, seeing how parents and that make the effort to actually get their kids to appointments, they actually have come to learn the value of what we actually do. We're now having a situation where a lot of our kids can actually walk a lot better, play sport, do things, and before a lot of these kids would have had a disability of some description.
I feel really privileged to be able to come and do these clinics and see these patients and work with the local staff, and it's wonderful to see a beautiful part of Australia.